Okay, everyone, thank you so much for coming today. I hope you've been having a lovely day. Today, you are here because you're here for the virtual health talk. So, we are joined by Marilyn Guzio, who is a diabetes educator and a registered dietitian. And as you already know, today's topic is how complementary and alternative medicine can support diabetes management alongside conventional care. So this session is going to highlight evidence-based practices such as herbs, acupuncture, nutritional supplements, and exercise, and traditional Chinese medicine to help improve overall well-being and balance. So with that, I will pass it along to our speaker. Thank you again, everyone, for coming, and I hope you enjoy this health talk.
Good evening. Thank you so much for coming. I appreciate this. My name is Marilyn Guzio. I'm a registered dietitian, diabetes educator, and my topic tonight is on complementary and alternative medicine. It'll be up in a minute. Just letting you. Okay. And I hope you enjoy the presentation, and I hope it's something that you will find beneficial and useful. One of the things I would like to point out before I start is that complementary medicine is a wonderful adjunct to Western medication. So I want to make sure to let everyone know that if you're when considering any of these alternatives, that you do have a conversation with your endocrinologist or your primary care physician, whoever is managing your diabetes, just so that they're on board and everything is will be working well for you. So start with diabetes, a little overview. It is a a metabolic disorder, in which your blood sugars have a bit of a problem regulating. It is very common. A lot of people do have diabetes, pre-diabetes, and the nutritional management for diabetes or pre-diabetes is the same. And one of the things that we really focus on today as diabetes educators and dietitians is heart health. So heart health along with diabetes is something that you're going to see over through the evening, of the importance of having good, strong heart health. So complementary medicine is so conventional medicine to control diabetes. Lifestyle modification, we're going to be talking about that. That works both ways. Exercise, eating well, speaking with the registered dietitian, diabetes educator to get some information on eating well, because the diet has changed over the past 30 years, and sometimes people have misinformation. And if you have diabetes, you probably have heard misinformation from some well-meaning friends and colleagues. So getting the right information can make your life a lot more pleasant. Um, Medications, there's a lot of new ones out. There's a lot of medications. There's the new weight loss medications, all sorts of things that control diabetes, and they're essential for glycemic control. And also, one of the things when you do have diabetes is that you do want to prevent or delay complications. So always talk with your physician. So what exactly is complementary and alternative medicine? So complementary medication, there are different therapeutic, interventions. They complement Western medicines, and they work in conjunction with that. And that's really what it is. And the goal, of course, with Western and the complementary medications is to have a positive outcome. Quality of life is so important. So listening to some of the suggestions say maybe something that you might find intriguing or interesting. So I hope that will be the result of this conversation. And alternate medicine, it encompasses practices, and it's independent of Western medication or mainstream medicine. So we're going to focus tonight more on complementary medication, alternate medicine. I would have a serious conversation with my physician, because it's more important to do the complementary and listen to what they have to say, because they are the experts in their field. So we have a holistic approach to complementary medication. And if you listen to all of the things that it can do, it's what we try to teach our patients to be able to do. And it treating the whole person. That's really what holistic medication is about, medicine is about. And it's a approach that enhances your life, which we always want to do. It can reduce stress, it can lower inflammation, improve your blood sugar control, which in turn will lower your A1C. Quality of sleep is really important. And when your blood sugars are in control, guess what? You feel wonderful. And that's what's important. So some of the theories that we're going to be talking about today, therapies, we're going to be talking about exercise and mind body therapies. We're going to be talking about lifestyle intervention. That's diet, herbal medications, different types of supplements. But again, always be careful. Don't take things without consulting your physician. Traditional Chinese medicine, which I found very fascinating. Um, Counseling and therapies. As a registered dietitian, I do nutrition. It's medical nutrition therapy, so it is counseling. Excuse me, which is addressing the whole person, not just here's a diet, follow it. It's like, how is this going to work with your life? Stress management. Stress is a part is here to stay in our lives. So being able to manage your stress through little techniques and tips could be helpful. Different behavior therapies, perhaps speaking with the therapist, all of these things can enhance your world, and empowerment strategies, teaching you how to be able to take care of your health and diabetes. And all of these things that we're talking about are going to support management strategies. Where did this go? Okay, oops, wrong one, sorry. Ready? So we're going to start with the simplest things. Regular exercise is something that's really important. You don't have to join a gym. You don't have to go to classes. Maybe you would just like to walk because walking is really a great exercise. We want to have, it lowers our cardiovascular risk, cardio, as you hear it. Strength training, keeps us strong, prevents falling as we get older. It can also, burn more fat if we're trying to lose weight. So having a regular exercise program, the recommendation is about 150 minutes a week of some type of physical activity. And you can do ideally 3 days of cardio and maybe 2 days, 20 minutes, maybe 10 or 15 different reps of exercise for strength training. So finding your groove is really what you want to be able to do. So a structured program is great, but I always suggest, take a look at your life, see where this can fit in, and make things that are going to be beneficial to you. Mind body practices are wonderful. Yoga, meditation, Tai Chi, acupuncture, Qigong. And these are in the Chinese traditional medicine, a lot of them, and they're good for overall. Yoga is encompasses meditation and encompasses stretching and all great things. It's good for balance. It's good for just feeling great. But we'll get a little bit more into that in a bit. Different lifestyle managements, what we talked about earlier. You want to you want to eat well. That's my that's my role in your life. Eating well, healthy lifestyle. We all need to be physically active. We all need to eat well. We all need to sleep well. But what goes by the wayside when we get a little bit busy? So taking time to live a more mindful life with lifestyle interventions and paying attention to making ourselves important. I had a client and she offered me the most, I thought this was fabulous and I love to share. She said that she was a teacher and every morning she walks for 30 minutes because that's me time. So sometimes reframing what you have to do opens up a whole new perspective. Instead of saying, I must walk, I must exercise, I'm going to spend time just like, for myself. Think about that. So that's something that can be a benefit. Wait a minute, come on, go. Why is this not going? Excuse me. Oh, okay. Some different lifestyle interventions. Smoking. Tobacco use is associated with higher rates of mortality and morbidity. So if you are smoking, smoking cessation is going to add years to your life, and you'll smell great. And also any kind of dietary modifications. Again, learning what is important and how this can work with your life. All food fits on a healthful diet. American Diabetes Association, their philosophy, eat a well-balanced variety of foods. Eat your 3 meals a day. Don't overeat. And remember that 4 hour window. Have that afternoon snack. Have that evening snack. And more importantly, enjoy all your food. And limit your alcohol consumption. Alcohol can, it's not your best choice. You never want to drink on empty stomach with diabetes. So limiting alcohol consumption can, again, enhance your cardiovascular health as well as manage your A1C. So we're going to talk a bit about dietary supplements. So there are supplements. Again, always speak with your physician and see if this is something that's going to work with your other medications. We don't want anything to interfere. They're all sold over the counter, and what I'm saying, what the research that I found is everything is this is what this medication possibly can do. And there's always ongoing research. There's no magic, but there's things that could be complementary, like magnesium. It influences insulin action and having a magnesium deficiency, and it's also a very trendy supplement right now, poor glycemic control. So one thing isn't going to fix it, but maybe eating a little bit better and making choices that could be beneficial to you, perhaps the supplement will be working. So that's what I want to say with that. Um, chromium is a trace mineral and it has a lot of positive properties coming out, possibilities of reducing fasting blood sugars as well, which can influence A1C levels. And variable, again, no magic. Vanadium, needs more research. So you don't want to overdo things. Everything has an upper tolerable limit. So being careful with any type of supplementation, even dietary supplements that you're taking. A honey supplement. This is a 3 month study that I found. Lowers pain threshold, and also diabetic neuropathies, which is numbness and tingling in your lower extremities. So it could be helpful in that possibility. Cinnamon. Now, cinnamon has been touted for many years with diabetes. It is a spice, increasing insulin sensitivity, so it makes your pancreas work a little bit um, better, and also helps to, get the glucose into the cells, which is the goal of insulin. And it can also help reduce cholesterol levels in type 2 diabetes. But again, it's not the by itself, it's just to enhance. And turmeric, another very common one. And turmeric is a spice, and usually for pain and wound healing. But it can improve the insulin sensitivity. So it is something, and the anti-inflammatory properties, and inflammation is the root of many issues. So something to possibly add to your repertoire. Okay. Mulberry leaf extract, that's promising, but again, it's something you're limiting glucose spikes as your after your is what's the potential for the mulberry extract leaves. And cardamom, another spice, antioxidant enzymes, so reduces oxidative stress and inflammation, which can be helpful in managing your diabetes. Flaxseed. So flaxseed is very interesting. Flaxseed is not only helpful with diabetes, but flaxseed also is an omega-3. which is a essential fatty acid, which means our body does not make it. So adding flaxseed is also beneficial for heart health. Throw a little bit in your yogurt in the morning or your oatmeal. So flaxseed has a couple of different roles that you may enjoy. Onions and garlic, we all use these, so this could be helpful. It's very popular in other cultures, and so it's the sulfate compounds that are the benefit, and similar to inulin, and that is something that helps reduce your blood sugars. Continuing on this vein, this is a legume, fenugreek, Greek, and that has some properties that could be beneficial. But there might be a little bit of GI upset that you may not appreciate. So again, know what you're getting yourself into. That was the only one that had a negative impact. Bitter melon is very popular in a Chinese medicine too. I've heard of that, and it can result in lower your glucose levels, and it's suggestive again. So more research on everything. And we talked about the mulberry leaf extract on the other page. And saffron, again, that's another spice. With the antioxidant. A lot of herbs and spices have antioxidant properties, and that also can be helpful in reducing stress levels. And there, so another avenue of help with managing diabetes. And prickly pear cactus, that's in Latin America. It's out also very popular in the southwest of the United States. And again, same type of properties as the other herbs that we were just, other supplements that we were talking, the other herbs that we were talking about. And Banaha, that's from the Philippines, crepe myrtle, as you've heard it here. Blood glucose levels, everything they all seem to have the same type of management. So it can be something that can enhance your blood glucose control. And again, pomegranate. So pomegranate is a great fruit, and it has antioxidants, polyphenols. So these are all things that there's a possible lowering of lipid levels. And when we talk about heart health, it is blood flow to the heart. We want to have something that is going to enhance our heart health as well as manage our diabetes. Um, Keeping in mind safety and efficacy, there are therapeutic doses, and this is really important to know. Needs further studies. Nobody's minding the store with herbal supplements, so it's up to the manufacturer for the efficacy and also the purity of that. There's the purity sign that you want to make sure that you have on the label when you're doing it. And so where's the product coming from? Is it standardized? What about quality control? There are potential risks for herbal medicines. So that's something that I think is really important to understand before making a decision. And again, patient safety and the efficacy of the medication is up to the manufacturer. They have food labels on them with the FDA, but they are not responsible for it. So it's a little bit more complicated with herbal medications and also supplements. This is the most interesting thing that I found in doing my research for this talk tonight, was the traditional Chinese medicine. So there's a lot of talk on this because it's really interesting, and it's not a cure. But what it does is it just tries to optimize how your body works, the thought process behind it, the understanding of the person as a whole. That's really what traditional Chinese medicine does. Of course, there's more research going on to be said with anything, but there are a lot of positive points to it. And it encompasses things I had said earlier about physical activity, eating well, and sleeping well. And a lot of the traditional Chinese medicine does promote those practices. So there are two basic Yin and yang. I'm sure you've heard of those. And it's that it's a balance. Yin and yang are a balance, and mm, so you want to make sure that that keeps your body in balance. Excuse me one second. I'm just looking. Where's my notes? Oops, go back. Sorry. Sorry, I just missed that. Okay, and then chi is um is your balance in your life. Okay, so okay, well, let's go back to so yin and yang are complementary opposites, and how things function in your world, and that's really what they're about. And they can't live without each other, and it's an interdependent relationship, and they transform each other. Chi is your vital energy, and that allows movement and maintains your activity of your life. And there's two different origins of chi: congenital, which we inherit from our parents, and also acquired from the food and the air in our environment. So it's kind of interesting. It's a very interesting philosophy how we're all connected to to our world, and that's really what it is with that. And so there's disharmony that can be associated with chi. And there's deficient chi, and that is functions of life are just not working as well as they should be. So people will be experiencing more lethargy and fatigue, less management of a disease state, and the feeling of not really wanting to move. So that would be what they a deficient chi. And a stagnant chi is when someone has a lot of aches and pains and really doesn't want to do anything. So that's the thing that happens with that. So think about that. That's a really cool way to look at ourselves in relationship to what's happening in the world. So meridians are the different pathways. Chi flows through our body. Uh, Qi, Jing, and Shen, and those are the three treasures, and they're essential for the for components of life. Just one, okay, okay. I hit the wrong thing. Components of life, and then the five elements theory. The five elements theory. They're continue like we're always continuing, we're evolving, we're growing, and changing within ourselves. And some become stronger, some become more dominant at all different points in life. And they are okay. Different. It defines your personality. It also they're all connected. So there's a wood personality, and that's someone who could be athletic, energetic, adventurous. There is also a fire personality, someone who's passionate, creative, authoritative. So thinking about yourself, and where are you fitting in with these different elements. Earth, someone who's nurturing, generous, caring, and giving. And this all makes so much sense. It's just wonderful. Um, Metal is someone who is meticulous, honest, responsible. And lastly, water personalities are considered, people have called old souls. They're wise and they're reflective and they're very private. And all these elements, they are connected. And so wood feeds fire, fire makes earth, earth creates metal, metal holds water, water nourishes wood, wood roots earth, earth dams water. So I wrote this out, and I don't normally like to read PowerPoints, but this was cool. Water extinguishes fire, fire melts metal, metal cuts wood. So it controls by other elements. So it's a huge connection, and I think that's really in the process, and it's balance. And so who are we? Where are we strongest? What's the most important part of our personality? But then again, on the other hand, where are we most vulnerable? So now I don't think anyone is one specific personality. I think we all have parts of all of the different five elements theory, so that gives us a little bit of grace, gives us a little bit of, uniqueness. But it's something to, if you're thinking of like, how we fit into the world, how does this all make a difference? In traditional Chinese medicine, acupuncture is really, really important, and that's using needles. And I was at physical therapy, and they were doing acupuncture on people, and I thought that was really interesting. It has a beneficial effect on pain management. That's mostly what it's used for in the Western society, but it also in traditional Chinese medicine, it can help lower your blood sugars. And so someone trained in the art is very they're really great at it. It just was really exciting to watch this happening. I've never experienced it myself, but I just thought it was kind of it was interesting. Moxibustion, it's using herbs to warm the acupuncture. There's all points on your body. There's over 300 of them. So different points relate to different aspects of healing or pain management. So that makes a big difference. So sometimes just using herbs instead of needles has a similar type of effect. Acupressure, lasers, magnets, that kind of stimulates the same different points throughout your body. So that's something that can be helpful, especially if you have neuropathies or for pain management. A lot of pain management does rely on, traditional Chinese measures. So I think it's something different that might be the answer to making you feel better. And I think if as you're listening and understanding the philosophies behind Chinese and medicine, it's all about the whole person. And that's what the complementary medicine is doing. It's addressing the whole person. Qigong, you've probably heard of that. It's a practice, and that's a mind body practice. And it's sort of like Tai Chi, but it goes a little bit farther, Qigong. And it involves more like a lot of spirituality along with movement. And what is that connection? And Tuna is a Chinese massage using hand manipulations and different types of therapies. So a lot of different herbal medications in Chinese, traditional Chinese medicine. Let me just move this because I'm missing. Okay. And they have they're cool, they're warm, they're hot, and the different senses. And so there's two specific herbs that offer effective treatment for diabetes wounds, perhaps. Saffron, we talked about that earlier. Different enhances antioxidant enzymes. So a lot of the herbs and are used more in the antioxidant realm. Korean ginseng, that's a hypoglycemic agent, so perhaps that could be help lower blood sugars. And the best part, it improves your mood and psychological performance. So when our blood sugars are managed, we feel great. That's really what we're looking for. Balsam pear, that's another one. That's pill form. Um, again, has been shown, the operative word is has been shown, nothing as definitive. So opportunities. Bottle gourd, again, it's a bill. It can be in pill form. 3 grams per day. Again, reduces blood sugar levels. And Jinkabak, again, it's fresh. It's made into a tea, and it's a lot. 9 grams is a lot, and again, helps reduce your blood sugar levels. And that's the things that we want to do. One of the things with Chinese traditional medicine, you want to, there's two forms of care. The importance of careful monitoring of someone's blood sugars and any kind of potential side effect because we may be on other medications. So we want to be careful, making sure that you're working with your healthcare providers, and letting them know anything that you're doing to manage any chronic illnesses that you have. Get their input because I think that's super important, to make sure that you're doing all things that are positive. Some of the like the qigong and tai chi, all of those types of like physical activity movements, those are great to do. And I think even just starting there is somewhere to go. Which leads us into different behavior theories, biofeedback. These are all things they can, for your mood and dealing with that. Depression can be a side effect of a complication of diabetes. So different behavior therapies, cognitive behavior therapy. There's quite a few different theories and models that we as dietitians address, but that's more for the therapy world. So reducing stress, how to deal with a diagnosis of diabetes. And so those are things that can be very, very important to do. We all have stress in our lives. How do you manage it can make a big difference because stress raises your blood sugars. And so because stress is a fight or flight response, and therefore if you can manage your stress, less incidence of having your blood sugars constantly being shot up because of an environment. And sometimes it's because you're sitting in traffic, but our bodies are programmed that we're running from a tiger. And so it's kind of hard to rationalize that when you're like being late for an appointment and you're sitting in that traffic and Route 80 doesn't move, it can be a little stressful. So, stress management techniques are really important too. Just sometimes it's good to just learn them. Different breathing techniques are good. Perhaps just different mindfulness, different letting your mind just wander. Relaxation techniques, all of those things can be very beneficial. And Counseling for someone who is a professional with someone with chronic illnesses, that can be helpful. Um, Aromatherapy, that can just make you feel good and your house smell nice. But mainly in diabetes, it's used for stress management, also for foot care if you don't have any wounds on your feet, but can make your feet feel really nice. So different aroma oils and things can have a big benefit to that. So you can go counseling is good. Meditation, visualization. Where do you see yourself in 6 months? Where do you see yourself in a year from now? And more importantly, what are you going to do today to make that a reality in your life? And that's how you want to approach things. And you can, with especially focusing on eating well. There's no bad foods, keeping that in mind, not listening to misinformation that's out there. I think that for my clients, that's one of the best uh, medications that we can do when they find out, you know what? I can enjoy my food and I can really enjoy things that I like. I don't have to give up things that I love. Moderation, of course, but still, the ability to have something that makes you happy makes a big difference. Also, and different relaxation techniques. Let's try all those deep breathing, all of that. It's all helpful. So complementary medicines, they work to create a holistic approach, looking at the whole person and making sure that it's not just one area that you're focusing on. Diabetes does have serious consequences and also complications, but controlling your blood sugars through a variety of different ways, eating well, sleeping well, adopting some of these things that we just talked about, maybe something that can be a benefit for you. So having that holistic approach, making yourself a priority is important, and they're widely used. And a lot of them are psychologically benefit. And if when you feel good, it improves your quality of life. And that's one of the things that is most important. We always want to know, how can we improve someone's quality of life? How can we make things better for you? Lowering your blood sugars. When your blood sugars again are stable, you feel wonderful. Exercise, nutrition, herbal remedies, traditional Chinese medicine, stress management, behavior therapies, counseling, and empowering yourself to be a priority and do things that are good in your life. But keeping in mind the safety and efficacy of the dose is really important. And so making sure you are talking to your healthcare provider and knowing what you're taking, where it's from, and you want to be really careful where a product is coming from. You don't want to buy it off the street because that's not going to be something that's going to be beneficial to you. Thank you. It was a pleasure speaking with you. If anybody has any questions, be happy to answer them.